For my friend, Luke.
For my mom, Paulette.
And for my mom, Phenia.
For my husband, Helmut.
Honor someone you love by learning the warning signs of stroke.
If you see face drooping, arm weakness, or speech difficulty, it's time to call 911.
A stroke can happen to anyone at any age. Be ready to spot a stroke fast.
Learn more from the American Stroke Association at stroke.org.
How great to see our local Seahawk sharing his love for his mom in this great video. Hope you guys enjoyed that. Hello, everyone, and welcome. My name is Gena Kreiner. I am a stroke program manager at MultiCare Health System, and I will be your moderator today. It's my pleasure to welcome guests from across Washington to the American Heart Association's community conversation about high blood pressure and stroke risk, sponsored by MultiCare Health System. We're so excited to have you join us today. Before we start, just a note to our audience. You'll notice a Q&A icon in your menu. This is where you want to enter your questions. Drop questions in the Q&A, and if we don't cover it, we'll follow up in an email. You can also feel free to comment and stay engaged through typing into the chat. And because this is a webinar, you don't need to worry about mute or unmute sharing or anything else. Just sit back and enjoy and relax with your virtual friends here. We're also recording this event, so if you miss anything, you can come back to it, okay? Today is a perfect time to learn about topics of high blood pressure and stroke. May is American Stroke Awareness Month, and a time where we work extra hard to share the signs of stroke. It's also High Blood Pressure Awareness Month, and yesterday was World Hypertension Day, so we're all in the right place. We're very pleased to introduce our first speaker today, Jennifer Spodobalski. She's a very special guest with us today, as she was a patient with us here at MultiCare. And Jennifer, we appreciate how hard it is to be here today, but I understand you want to spread awareness. Tell us a bit about the day you had your stroke. I think Jennifer's just coming on.
Having a little technical difficulty. It's not letting us unmute Jennifer. Jennifer, are you able to find the unmute button over in the bottom left corner?
I think I got it.
There you go.
Okay, sorry. Okay, should I start over? What part? Okay, so August 23rd, 2022, I had a stroke at about 12 o'clock at night. I was at the casino with my husband. He dropped me off at the front door and went to go park the car. And I realized I couldn't speak. I went into the casino to wait for my husband. I should have stayed outside probably, but I went in and I just was kind of being, I was ignoring the situation. But when my husband came in, he found me, he said something to me, I couldn't talk back, couldn't talk to anyone. My brain was functioning, but my mouth wasn't. So he wanted to go to the hospital right away. And I said, no. And he wasn't listening to me, but that's okay. I wanted to go home and change first. Don't do that. That's not a good idea. He got in the car and took me to the hospital. I was there within 45 minutes of the onset of the stroke. They administered some medicine to me, and pretty much I was in the emergency room for about 7.5 hours. And then they admitted me into Tacoma General, and I was in ICU for 5 days, and I was released in 8 days. I'm a very lucky person. I can still speak, and most of my motor functions are pretty good. My brain seems to be okay, but I have to assure you, it is very important that you do go get help right away, because hours matter, time matters. They can administer the medication to you to help you get better. And that's my story. Is anybody there?
Yes, thank you, Jennifer. We appreciate you so much.
Thank you.
Jennifer, what I'm hearing you say is one message that I got very clearly was it's very important to call for help. Even like, and we always want people to call 911, but it's important to get to the emergency department as fast as possible so they can administer medication, clot busting medication that will help you be more functional.
Yes, and I think that's ultimately important. I had a second stroke apparently in the hospital, in the emergency room. I did not know that, and they let me know that. So if I had not been at the hospital being monitored, that could have been very detrimental. So it is important to go to the hospital and go see medical attention right away.
Thank you, Jennifer. We appreciate you very much. Thank you so much.
Thank you.
Now I have the pleasure of introducing Dr. Chuang. Dr. Chuang is a vascular neurologist and is the neurohospitalist at MultiCare Auburn Medical Center. He graduated from the University of Missouri and then completed his training in both neurology residency and stroke fellowship at Case Western University in Cleveland, Ohio, prior to moving to the Pacific Northwest and joining MultiCare Neurology in 2021. Don't forget to put your questions in the Q&A or in the comments if you have any questions during this session. And Dr. Chuang, I think I'll turn it to you.
All right, can you hear me okay, everybody?
Yes, I can hear you good.
All right, yeah, thank you so much, Gena, for the introduction. And thank you so much, Jennifer, for sharing your personal story and that very powerful message on the importance to seek care, especially during that acute stroke phase. I think that's very, very important for everybody to hear that. So yeah, it's my pleasure to, give a short presentation today, talking about, some of the important aspects of stroke and how high blood pressure can contribute to stroke and what we can do about it, especially in terms of stroke prevention. So I'm going to start out with kind of introducing stroke as a general disease first. What exactly is stroke? There's different types of stroke. The most common one that we're all familiar with is actually the ischemic stroke. So this is what happened when the blood vessel in the brain is being plugged up by a clot. You can see on the illustration on the left, there is a clot sitting in the blood vessel, and then that part of the brain is not getting any blood flow or any nutrition. There's energy failure, and that's why the brain died off, because of the clotting that happens. There's another not as common type of stroke, but just equally as important, and that would be the hemorrhagic stroke. This is on the opposite. It's not a clot that happens in the brain blood vessels, but it's when a blood vessel bursts and you have all the blood that kind of spilled into the area and cause a dysfunction in the stroke. It's what we usually refer to as a bleeding type of stroke. Just as important, with a lot of similar characteristic and different etiology. And people usually can also hear about transient ischemic attack. We also call this TIA, or some people call it mini stroke. This is essentially an ischemic type of stroke, like the first one, but the clot either doesn't stay there or there's some compensatory mechanism, and so the patient doesn't have persistent symptoms. Usually the symptom resolve within 24 hours, and so we call this a transient ischemic attack. Just as important, people who had a stroke or have a transient ischemic attack will likely have another one within 30 days, so it's just as important to get this worked up as quickly as we can. All right, next slide, please. So I just want to share with you some pretty alarming statistics regarding stroke. Every year in the United States, there's about 800,000 strokes that happen every year. The majority of these, about 600,000, are first time or new strokes, whereas the rest of them are recurrences in people who already had one. Most of them are ischemic strokes, like the ones that cause a clotting in the blood vessels, 87%. And if we put that into kind of numbers, essentially it averages out to every 40 seconds, somebody in the United States is having a stroke. The mortality is quite high, not as bad as before. There's life-saving procedures that we can do for quite a few of these strokes, but still every 4 minutes somebody dies from a stroke. Unfortunately, even people who survive through it, a lot of them can have long-lasting disability, and stroke is a leading cause of long-term disability in the United States. There's a lot of risk factors that are associated with the stroke, but the most common ones are high blood pressure, high cholesterol, smoking, diabetes, and obesity. And a lot of people think of stroke only as an old people type of condition. However, that's not true. 38% of people who are hospitalized for stroke are actually 65 years or younger. So it's important to recognize that this also happens in young people, and it's important to recognize it as well. Next slide, please. So thank you, Jennifer, for pointing out that the importance of recognizing stroke symptoms. The current recommended the acronym for stroke is FAST. So this stands for F as in facial drooping. If you see somebody with a facial droop, then it could be a sign of stroke. A stands for arm weakness. If you see anybody with an arm or leg weakness that happened acutely, it could be a sign of stroke. S stands for speech difficulty, including slurring of speech, difficulty communicating or understanding. And T simply stands for time. We always say time is brain. If you notice that anybody have any signs of stroke, you got to call 911 right away. Time is brain. The longer you let the symptoms last, the more likely that there's going to be persistent injury to the brain and more long-lasting side effect. And just like Jennifer and Gena pointed out earlier, there are therapies that can only be offered within a certain period of time, like the clot busting medication. And so it's important to get to the hospital to get evaluated for that right away. Of course, the stroke symptoms are not limited to just the FAST. There's also other things like numbness, confusional states, trouble seeing from your eyes or visual field, trouble with walking, tumbling over the place, coordination issue, and sometimes, especially in bleeding type of stroke, having a severe headache may indicate stroke as well. So it's important to recognize these symptoms as well. Next slide, please. All right, so kind of circling back to the focus of today's presentation, we want to talk about high blood pressure. Very surprisingly, actually about half the population in the United States have some degree of blood pressure issue. And only 22% surprisingly had it under control. So not a very high percentage, which kind of raises the awareness that we need to do a better job in terms of blood pressure control. There's also a lot of different differences when it comes to different ethnicity and races as well. And just to share a couple of these examples, for Black people, they have the highest percentage of blood pressure issues, sitting at 55%. Hispanic people had the lowest percent of treatment at 42%. And for Asian people, there's lowest percent of people under good blood pressure control, only at 15%. And so these are some differences in different racial groups. Next slide, please. And so, a lot of people actually don't know that they have blood pressure. A lot of people didn't realize that this is a serious condition until something happens. We often call high blood pressure a silent killer, because a lot of times your blood pressure is high, but you're not actually symptomatic from it. Your body learns to adjust to the symptoms, but then while the body is doing that, the high blood pressure is injuring other organs like your kidney. It's building up plaques in your blood vessels, leading to long-term complications, for example, heart attack and stroke, when it's left untreated for too long. Also, I want to point out that the COVID pandemic that started a couple years ago also kind of amplified a lot of these risk factors. It kind of led to people being reluctant to go to the doctor for a good period of time. They don't have adequate healthcare access during that period of time. So we kind of lag behind in terms of these cardiovascular risk factor control for some period of time. It's very important to recognize getting these chronic cardiovascular risk factors under better control so that we can act and prevent unnecessary time loss with people that we love. Next slide, please. So when it comes to cardiovascular risk factors like high blood pressure, there's a lot of different things that can contribute to it. There are risk factors that are modifiable, which means that there's things that we can do in our daily lives to improve it. And there's also non-modified risk factors that unfortunately, we can't do much about it in our daily lives, but there are ways to overcome that as well. When it comes to modifiable risk factors, the biggest risk factors are things such as physical activity, your diet, exercising, weight, alcohol, tobacco use. And when it comes to the non-modifiable risk factors, that things that we cannot change on our daily life, these include things like race, family history, gender differences, chronic kidney disease, and other health conditions that can contribute to it as well. Next slide, please. So going back, what exactly is blood pressure? You can imagine the heart as a pump. Every second or so, it's pumping blood out of the heart throughout your entire body to supply the energy, the blood supply. And when the heart pumps the blood into your blood vessels, and you can think of blood vessels as pipe, it exerts, kind of jets of blood into your other parts of the body, and it exerts a pressure on the blood vessels, on the pipes. And that's the blood pressure that we measure when we put on those blood pressure cuffs that everybody is familiar with, that you can get it done at home, in hospital, in clinic settings, and such, so far and so forth. High blood pressure simply means that the pressure that we're measuring is being too high, and there's a lot of different contributing factors that can cause that. For example, as we age, our blood vessels are not as elastic. And so you can imagine when you're pumping water, pumping blood into a very stiff pipe, that tends to exert a higher pressure as opposed to you're pumping fluid into more like a rubbery type of substance where there's a lot of room for that to adjust and cause a lower blood pressure. Next slide, please. And so when we measure our blood pressure, usually we see two different numbers. What does it all mean? So the top number is also called the systolic pressure. This is the pressure that we measure when the blood is actively pumping the blood into the blood vessels. Usually this sits around 120, 130 for people with high blood pressure. We typically see higher numbers, even up to the 200s. So this is number that we measure when the heart is actively pumping. Now, the bottom number is also called the diastolic pressure. This is also the pressure inside the blood vessel. However, this is when the pump is relaxed. And so these numbers tend to be lower. The heart is not actively pumping during this phase. It's not exerting additional pressure to those blood vessels. And the number that we typically see is about 80. And in people with high blood pressure, then it's higher than that. Next slide, please. So this table shows kind of like a range of different blood pressure and what it all means. Like we talked about earlier, a normal blood pressure, the upper number should be less than 120. And the lower number should be less than 80. So 120 over 80, this is what we usually consider the gold standard normal blood pressure. When the upper number start to creep up a little bit into the 120s, this is when we start to call it pre-hypertension. You don't technically have high blood pressure at this stage, but it is a warning sign that you're kind of developing and kind of trending towards developing high blood pressure. It's kind of like a warning sign that, hey, probably should cut down on salt intake, exercise more, lose a little bit of weight, and see if we can naturally get that number down back to the normal range again. When the upper number is more than 130 or when the lower number is more than 80, this is when we really get into the range where we're calling it high blood pressure. There's different stages, stage 1, stage 2, and hypertensive crisis, which is more than 180 to kind of indicate the severity of the disease. Next slide, please. And so what are some ways that you can do to measure your own blood pressure? So of course you can measure these at home, you can measure these in doctor's office and pharmacies and the hospital. And we hear a lot that people go to the doctor's office, they're very nervous, and then they usually get like a higher blood pressure than they typically do. And so I just want to point out a couple tips to kind of make sure that we can get accurate blood pressure reading. Always make sure that you're relaxed. Sit down somewhere with good feet support. Make sure your arm is very well supported on the table, on a flat surface. Don't talk, don't get nervous when you're doing the measuring, and just kind of relax. Make sure you empty your bladder first so that you don't get that additional factor that can elevate your blood pressure. And this is how, and also make sure you don't measure it as soon as you sit down. Probably sit for about 2 minutes. Make sure you're calm first before you measure your blood pressure. This is how we can get the most accurate blood pressure reading. Next slide, please. So if you notice that you have high blood pressure, if you're diagnosed with it, if you're measuring at home and you realize that your blood pressure is always above 130, what do you do? So continue to measure your blood pressure at home. Do it a couple times a week, write down the numbers, keep a log, bring it to your doctor's office and show your doctor your blood pressure log to see if you can come up with a strategy to target that. You can improve your lifestyle, do some lifestyle changes and modification to improve lifestyle kind of factors. For example, improving diet, cutting down on salt, cutting down on oily food, exercise, work on losing a little bit of weight if you're trending towards the higher side. And if needed, if all those natural things doesn't work, there's always medications that can be considered. And there's many types out there that can be catered based on individual history, gender, race, and everything. Next slide, please. And finally, actually, this is the last slide, but I just want to point out a couple of very important elements in this talk. So we talk about the stroke, different mechanisms. It's either when there's a clot inside the blood vessel in the brain, or there's or the blood vessel bursts and there's bleeding into the brain. High blood pressure can lead to a lot of cardiovascular diseases, not just limited to stroke, but kidney issues, peripheral vascular disease, heart attack, blood vessel plaque buildup. It is a very important risk factor that we need to recognize. And it's very important to recognize that 80% of the stroke actually can be prevented from lifestyle modification, these cardiovascular risk factor control and optimization. And in terms of blood pressure, the normal blood pressure is 120/80, like we talked about before. 1 in 8 people don't even realize that they have blood pressure. So this is something that we can do on our daily lives, measuring to make sure that we're aware of that and to target it early. When we look at people at age 50, people who did not have blood pressure have a life expectancy 5 years longer than people who have high blood pressure. So very important, so that we don't lose precious time with our loved ones. And there are different things that you can do. Monitor your blood pressure, work with your primary care doctor or cardiologist on strategies to control the blood pressure so that we can reduce these risks of long-term complications like stroke and heart attack. And that's all the message I have for everybody today. And thanks for listening in. Yeah, and I'll give that podium back to Gena again.
Thank you, Dr. Chuang. That was really great. We do have some questions in the chat that I'd like to address. The first question was about when you're having a stroke, will you be able to call 911? And that's a really hard question because it depends on what deficits you have during your stroke. And I would have to say that sometimes it is very difficult. What I do want to mention is a lot of cell phones now do have an emergency button. For example, Android phones has an emergency call button. I don't think a lot of people maybe even know about this. I actually learned about it a couple of years ago, but that button can be used even if your cell phone is locked. Most people have to swipe it and put your code in, but it's just a one call emergency call button. So if there's a way to get your cell phone and push that button, and then iPhones now also have some emergency call things in order to get that 911 call out. So if you're down and it's really hard, the best, if you can get to a phone and try to call 911, even if you're, you know, it could be really hard. The second question is about aspirin therapy. And I would say if you're having a stroke at home, don't worry about trying to get an aspirin. In fact, it may affect your swallow, and that may be kind of dangerous to try to swallow something. So what's more important is just trying to get to the hospital fast. 911 is the way to go because they know which hospitals to take you to. They will call ahead of time, so the team will be ready for you and you'll go directly to the CAT scan. So 911 is the best call. Don't worry about trying to take an aspirin or anything else like that, because it could be kind of dangerous if your swallow is being affected.
Yeah, Gina, I completely agree with that. And also, you know, we talk about the different types of stroke as well. There's the clotting type of stroke and there's a bleeding type of stroke as well. So at the beginning, we don't know whether this could have been a bleeding type of stroke, and taking aspirin, additional blood thinner, can also worsen that, you know, if we don't know the exact mechanism. So like Gina suggested, 911 is the way to go.
Right, and that's a really great point, is we don't know what kind of stroke it is. So it's important that you're just getting to the hospital so they can diagnose you and treat you. And there was another question about what's the best time of day to take your blood pressure. And I'm just going to address this really quickly, is the morning time, but there's some specific things that you have to do. It's not just the morning. So typically they say, you know, get up, go to the bathroom, and then as Dr. Chuang says, sit down with your feet on the floor, make sure you're rest and comfortable for about 5 minutes or so. And then take your blood pressure. You know, you can't get up and have your coffee and have that caffeine and then take the blood pressure. It's best to do it first thing in the morning after you wake up, you know, relieve your bladder, make sure you're sitting and you're nice and calm, and then take your blood pressure and then enter it into a log so your doctor can see how that is. Because the morning time is the best way to know if you are taking blood pressure medications, also if those are working. So it's really helpful for your doctor to see that log. Let's see, did we have more questions in the Q&A?
There is one more, and it's a question about the connection between migraines and stroke, if the physician has time.
Yeah, absolutely. Yeah. So yeah, certain type of migraine do increase this risk of stroke, especially the ones with aura. It's about 1.5 to 2 times more likely for people who has an aura type of migraine to have a stroke, you know, in their lifetime. However, compared to all the other vascular risk factors, this is actually, you know, not as high, you know, compared to other things like high blood pressure, cholesterol issues, diabetes, smoking, and such. But yes, there is a theoretical risk, especially for people who have migraine with auras.
Okay, and we are getting a little close on time here, so I just want to help by closing this up. And Jennifer and Dr. Chuang, want to thank you for all your insight you've provided today. I know you've given us a lot of food for thought, and we appreciate you very much for the information today. Today we touched on some important topics, and we want to leave you with some additional resources. So please review the chat for some links for information. If there are any questions that you were asked in the chat that we didn't get to, we will also follow up with an email. We also want to thank you, the audience, for listening with open ears and for sharing what you've learned with others in your life. After you exit out of Zoom, you will see a pop-up to take a short survey. We'd appreciate it if you would complete this short 1-minute survey to provide some feedback about today's event and ideas you'd like us to consider for the future. We will be hosting another webinar on June 7th to discuss ways to reduce stress, and a link to register for that event will be included in the chat. So stay healthy, everyone. And thank you again